Hello all, I am Dr. Narendra Patwardhan from Pune. I have been in the skin practice for about 40 years. On the occasion of World Vitiligo Day on 25th of June, Glenmark Pharmaceuticals Limited has launched a patient awareness initiative called Embrace Your Innerself. I take this opportunity to spread the message of truth, embrace and transform through my interaction with you on Facebook Live. Let me start by talking about the facts about this condition, vitiligo. It's a skin condition in which the pigment producing cells of the skin, called as melanocytes, are destroyed. The exact cause of vitiligo is not known. It is an autoimmune disease with underlying genetic predisposition where sometimes the body destroys its own tissue, perceiving it as a foreign. This is known as autoimmune reaction in the body. This is also believed to be a cause of melanocyte damage. The inheritance pattern is complex since vitiligo is caused by multiple factors called as multifactorial disease. On an average, it has been found that 20 to 30% of all vitiligo patients have at least one close relative affected by the disease. Importantly, vitiligo is not transmissible to the family members or contacts. Moreover, all white patches on the skin are not vitiligo. There are other causes of the white patches also. So, white patch itself does not mean it is vitiligo. A dermatologist can help in differentiating between various types of white patches. So, friends, consult your dermatologist for better understanding and the right treatment option for this condition. Now, let me tell you about what are the treatment options available for these conditions. The goals of the treatment are to control the spread of the condition and to regenerate pigmentation in the areas that have lost the same. Treatment choice in vitiligo is based on number, site and extent of involvement and the patient convenience. Also, supportive camouflage treatment helps to reduce the social problems while the patient is on the corrective treatment. There are various therapies available. The local therapies are the medications called as sorolins, and we apply it to the patch and expose it to the sunlight later on. In the recent advances, the new medicines which have come into the market are drugs called as JAK inhibitors. These are the one which as on today probably are not available in India but should be available soon. The second line of treatment is called as phototherapy. PUA therapy was the old one, and the NBUB, that is narrow band UVB therapy, is the treatment which is meant for the extensive diseases. For the localized patches, we use a therapy called as excimer light therapy. Now, in case with this therapy, if the patches become stable, if the new patches do not appear for at least 1 year duration, then we opt for surgical treatment. It involves various types of grafting, punch grafting, split thickness grafting, then blister grafting, and of late we have been using it called as a keratinocyte melanocyte suspension, wherein if you take one portion of the skin, because of this technique we can cover at least 10 parts areas of the vitiligo patches. Vitiligo, friends, is an autoimmune disease, and therefore, as with any other autoimmune disease, it cannot be fully cured. Treatment can slow its progress and in many cases prevent further spread of the disease. However, the disease may recur after stopping the treatment. Vitiligo can be treated effectively if a person consults a dermatologist at a very early stage. So, if you doubt something, please consult your dermatologist. He will be the best person to give you the proper advice. Proper treatments with regular follow up can increase the chances of complete pigmentation. Now, friends, my final message to the society is that you should not discriminate against the individuals with vitiligo. You have to understand that it is just a skin condition and not a curse, and it is definitely not infectious, not contagious. That patches are not likely to cause any similar patches if that patient comes in contact with the other person. A person with vitiligo can marry. Your outlook towards vitiligo affected patients should change, and they have to be a part of your daily life and society. I thank Glenmark for this wonderful initiative and fully support the cause of eradicating the social stigma associated with this disease. Stay blessed, stay safe, and have a wonderful day today. Thank you very much.
Post म्हणून ऑप्शन